Good afternoon, and thanks for joining us for today's ZOHU call. The webinar will begin soon. Please stand by. Good afternoon. I'm Keisha Bohannon, and I work in the National Center for Emerging and Zoonotic Infectious Diseases at the Centers for Disease Control and Prevention. On behalf of CDC's One Health Office, I'm pleased to welcome you to this Zoonoses and One Health Updates call on June 5th, 2024. Next slide, please. Although the content of this webinar is directed to veterinarians, physicians, epidemiologists, and related public health professionals in federal, state, and local positions, the CDC has no control over who participates. Therefore, please exercise discretion on sensitive content and material, as confidentiality cannot be guaranteed. Today's webinar is being recorded. If you have any objections, you may disconnect now. Links to resources from each presentation are available on our website at cdc.gov/1-health/php/trainings-events/June-2024-ZOHU-call.html. Next slide, please. Today's presentations will address one or more of the following 5 objectives. 1, identify an implication for human, animal, and environmental health. 2, identify a One Health approach strategy for prevention of public health threats. 3, identify a One Health approach strategy for detection of public health threats. 4, identify a One Health approach strategy for responding to public health threats. 5, list 2 ways to improve collaborative practice across the public healthcare team. Next slide, please. In compliance with continuing education requirements, all presenters must disclose any financial or other associations with the manufacturers of commercial products, suppliers of commercial services, or commercial supporters, as well as any use of unlabeled products or products under investigational use. CDC, our planners, presenters, and their spouses wish to disclose they have no financial interests or other relationships with the manufacturers of commercial products, suppliers of commercial services, or commercial supporters. The Planning Committee reviewed content to ensure there is no bias. The presentations will not include any discussion of the unlabeled use of a product or a product under investigational use. CDC did not accept commercial support for this activity. Next slide, please. Instructions for receiving free continuing education are available at cdc.gov/1-health/php/zohu/index.html. Please note that we are awaiting approval to offer American Association of Veterinary State Boards Registry of Approved Continuing Education, or AASVB, RACE credits. The RACE credits are not currently available for May and June 2024 ZOHU calls. To receive free CE for today's webcast, sign in or create an account at train.org by July 8th, 2024. The course access code is ZOHU Webcast. A captioned video of today's webinar will be posted on our June call page within 30 days. Free CE for the web-on-demand video of today's webinar will be available until July 9th, 2026. Next slide, please. So before we begin today's presentations, Dr. Ria Guy, One Health Office epidemiologist, will share some news and updates.
Thanks so much, Keisha, and good afternoon, everyone. Thanks for joining us for our June ZOHU call. Please remember to share the ZOHU call website link with your colleagues from public health, agriculture, wildlife, plant, and environmental health fields, as well as other sectors, so that we can let them know about the live webinars, video recordings, and free continuing education that this webinar offers. Before we start the presentations for today, I'll take a moment to share some updates and resources. You can find links to these resources in today's ZOHU call email newsletter. If you aren't yet subscribed to that newsletter, please sign up using the link at the top of the main ZOHU call webpage so that moving forward, you can get those ZOHU call updates. CDC is working closely with USDA to monitor the current H5N1 bird flu situation in wild birds and poultry, dairy cows, and sporadic infections in other mammals. You can find the latest updates on USDA and CDC's website, including situation updates, recommendations for protective actions for people, confirmed cases in domestic livestock, and more. Next slide, please. In today's newsletter, we highlight several recent publications, including one that's titled Eliminating Invisible Deaths, the Woeful State of Global Rabies Data and Its Impact on Progress Towards the 2030 Sustainable Development Goals for Neglected Tropical Diseases. We've also got another titled Shiga Toxin Producing Escherichia coli 0157H7 Illness Outbreak Associated with Untreated Pressurized Municipal Irrigation Water in Utah 2023. Next slide, please. We've also highlighted publications about environmental phenol exposure in 6 to 12-week-old infants, the Infant Feeding and Early Development Study, and a scoping review on the topic of climate change, malaria, and neglected tropical diseases. Next slide, please. Here, we've highlighted some announcements and resources, including a Health Alert Network announcement regarding adverse effects linked to counterfeit or mishandled botulinum toxin injections, and a couple newsletters linked to the Food and Agriculture Organization of the United Nations One Health newsletter. We've also got the National Wildlife Health Center's newsletter. Next slide, please. Here we've got some June observances and events that might be of interest, and these include World Environment Day on June 5th, World Food Safety Day on June 7th, and a United Nations World Oceans Day live broadcast taking place on June 7th for the June 8th observance. Next slide, please. Finally, we've shared some ongoing outbreak investigations, and these include a recent E. coli outbreak linked to organic walnuts, as well as 2 separate salmonella outbreaks, one linked to backyard poultry and another linked to fresh basil. You can visit CDC's Healthy Pets, Healthy People website for a selected list of ongoing past U.S. outbreaks of zoonotic diseases and find details about ongoing U.S. outbreaks on the CDC websites linked from today's newsletter. Next slide, please. So our next ZOHU call is going to take place on August 7th, 2024. Please continue to send presenter and topic suggestions for future presentations, as well as news from your organization to zohucall@cdc.gov. That's all I've got for today, so I will hand it back over to you, Keisha, and next slide, please.
Thanks so much, Ria. So you can submit questions at any time using Zoom's Q&A feature. Please include the topic or presenter's name. The Q&A session will follow the final presentation if time permits. You may also email questions to today's presenters. For the updates to CDC dog regulation effective August 1, 2024 presentation, if you have questions, please email cdcanimalimport@cdc.gov. We've included the emails on the slide, but just mentioning the CDC Animal Imports email that is not included on the slide today. Now we can begin our presentations. Next slide, please. Today's presentation, Updates to CDC Dog Regulation, effective August 1st, 2024, will be presented by Dr. Mark Friedman. Please begin when you're ready.
All right, good afternoon, everybody. Can you hear me okay?
Yes.
All right. I will be reviewing the updates recently announced to CDC's dog and cat importation regulation, which will go into effect on August 1st, 2024. Next slide. This is a quick view of the agenda. Next slide. This is a high-level summary of what documents CDC will require for dogs arriving into the US after August 1st. Requirements are based on where the dog was vaccinated and what countries the dog visited in the 6 months before arriving into the United States. I will go into more detail for each of these scenarios during the rest of the presentation. Next slide. So why were the regulations updated? Next slide. CDC updated the rules to import dogs into the United States to protect the health and safety of people and animals and to prevent the reintroduction of dog rabies into the United States. The new rules will apply to all dogs arriving into the United States. The current temporary suspension of dogs from high-risk countries will expire on July 31st, 2024. Next slide. This update addresses the numerous challenges CDC, U.S. Department of Agriculture, and U.S. Customs and Border Protection have documented with dog importations over the past 5 years, including fraudulent rabies vaccine documentation and unsafe housing conditions for dogs at ports of entry. CDC updated this regulation using lessons learned during its temporary suspension of dogs from high-risk rabies countries. The regulation will more closely align the U.S. with international standards set by the World Organization for Animal Health and those of other dog rabies-free countries. The regulation also provides for facilities to safely quarantine dogs to make sure they are fully vaccinated against rabies and care for ill or injured dogs. This helps detect illness in foreign vaccinated dogs and ensure they do not pose a public health risk before being released into U.S. communities. The new requirements will also guarantee more pre-departure checks are in place for dogs to ensure they are healthy and vaccinated against rabies prior to traveling. The examination and vaccination of dogs with a USDA licensed rabies vaccine upon arrival will ensure all dogs are adequately protected against rabies with high-quality vaccines that are known to be safe and effective before being released into U.S. communities. Next slide. The 3-month gap between the announcement of the new regulation and its effective date provides time for importers to plan for their dog's future travel to ensure that all appropriate requirements will be met. CDC has updated the dog importation websites and now includes the dog bot, which is, you can see a screenshot of here, which is a system that will walk the importer through the steps and requirements for importing their dogs, depending on where they are traveling from, where they are traveling to, and whether and where their dog was vaccinated for rabies. I will go in, depending on the time, I'll try and demonstrate some dog bot screenshots. Next slide, please. Next slide. So regulations for the importations of cats are minimal, but the new rule does clarify testing requirements for cats that arrive ill or dead. There are no vaccination requirements for cats. However, cats are susceptible to rabies, and CDC recommends all cats be vaccinated against rabies before traveling. Cats that arrive ill or dead will be required to undergo examination, testing, or necropsy if they've died to rule out zoonotic diseases of public health concern at the importer's expense. Next slide. So now I'll go into the specific requirements for all dogs entering the United States starting on August 1st, 2024. Next slide. All dogs entering the U.S. must be at least 6 months of age at the time of entry or return to the United States. This helps to prevent fraud, ensure dogs are old enough to be fully vaccinated against rabies, and prevent health risks such as illness and death associated with the transport of very young dogs. All dogs must have an implanted International Organization for Standardization, or ISO, compatible microchip. And this microchip must be implanted prior to any required rabies vaccine. This will help ensure that dogs can be matched to their required documents. Dogs must also appear healthy upon arrival. Dogs may not enter the United States if they are carrying a disease contagious to people. And isolation of the dog, veterinary exam, and additional testing may be required to determine if the dog has a contagious disease. Dogs must also have a CDC dog import form receipt, which I'll go into in the next few slides. And then they'll need to have additional documentation which will vary depending on where the dog has been in the 6 months before entering or returning to the United States and where the dog was vaccinated for rabies. These rules will apply to all dogs, including service dogs. Next slide. Beginning August 1st, CDC will require all importers to complete and submit a CDC dog import form online prior to arriving in the US. There is no fee to complete this form, and this form will be available online beginning July 15th. The form captures basic information about the dog and their travel itinerary. Next slide. The form requires the importer to upload a photo of the dog's face and body for identification purposes. And importantly, all information on the form must be correct at the time of arrival. If any of that information changes before the importer is scheduled to arrive, the importer can submit a request to update the form to make those changes. Next slide. This form by itself is not sufficient to enter the United States. The importer must also have one of CDC's required endorsed vaccination forms, depending on which country or countries the dog has visited in the 6 months before arriving in the US and where it was vaccinated against rabies. Next slide. First, let's review the requirements for dogs with a current and valid rabies vaccination administered in the United States. Next slide. US vaccinated dogs must meet all the requirements outlined in the All Dogs section. In addition, they must have a certification of US issued rabies vaccine form. This form must be completed by a USDA accredited veterinarian before the dog departs the US. USDA accredited veterinarians can already access this form and its instructions online. The form must be endorsed by USDA before the dog departs the United States. And the form can be valid as long as the rabies vaccine is valid. And so that could be either 1 or 3 years, depending on which vaccine was used. If the dog does not have this certification of US issued rabies vaccine form, or the form is no longer valid, where in the case where the rabies vaccine has expired, then the dog must follow the requirements for foreign vaccinated dogs from a high-risk country to be eligible for entry. Next slide. CDC is authorizing a transition period that will start on August 1st of this year and expire July 31st, 2025. During this transition period, if a dog left the United States without the certification of US issued rabies vaccination form, the form can be completed retroactively by a USDA accredited veterinarian. And if you go to our website, you'll see the details of how that can be done. Also, CDC will accept a USDA endorsed export health certificate that lists the dog's age. Again, the dog must be at least 6 months old, the dog's microchip number, and the date of the most recent US issued rabies vaccination. This health certificate is valid for re-entry as long as that rabies vaccination that's documented has not expired. Next slide. So what are the requirements for US vaccinated dogs that have not been in a rabies high-risk country in the past 6 months? Next slide. These dogs must meet the requirements that were listed in the All Dogs section. In addition, the importer must have one of the following documents. One is the certification of US issued rabies vaccine form that was endorsed by a USDA accredited endorsed by the USDA before the dog departed the United States, or they can use a USDA endorsed export health certificate that demonstrates the dog's at least 6 months old, lists the microchip number, and must be for the dog rabies-free or low-risk country where the dog's return itinerary originated. This form is valid for a single entry into the United States for 30 days after it was issued if it does not contain information about rabies vaccination administered in the dog rabies-free or low-risk country. Or this form can be valid for multiple entries into the US for the duration of the rabies vaccine validity period, either 1 or 3 years, if the rabies vaccine is documented on this health certificate. And again, if a dog does not have one of these USDA endorsed forms, or one of the forms no longer valid, then the dog must follow the requirements for foreign vaccinated dogs to be eligible for entry. Next slide. Next, we'll review the requirements for foreign vaccinated dogs that have been in a high-risk country for dog rabies in the past 6 months. Next slide. These dogs must meet the requirements outlined in the all dogs section, and they must also have a complete certification of foreign rabies vaccination and microchip form. This form will need to be filled out by a veterinarian in the country where the dog is vaccinated, and then endorsed by an official veterinarian, an official government veterinarian in the exporting country. This form will be valid for 30 days from the date of issuance. They also must have a valid rabies serology titer from a CDC approved laboratory. However, a titer is not required if the dog has a reservation or a 28-day quarantine at a CDC registered animal care facility or ACF. In addition, the dog will need to have a reservation at an ACF for examination and revaccination and quarantine if the dog doesn't have this valid rabies titer. And lastly, the dog will need to have an international flight that arrives directly at the airport with the ACF where the dog has the reservation. Next slide. I wanted to highlight some of the changes between the temporary suspension and this new rule. Under the new rule, the microchip must be implanted before the rabies vaccine was administered for the vaccine and rabies titer to be considered valid. The blood sample for the rabies titer must be drawn at least 30 days after initial rabies vaccination and at least 28 days before entry into the United States. CDC used to require a 45-day waiting period during the temporary suspension, but we've reduced this wait period to 28 days under the new rule. Lastly, under the new rule, if the dog receives a passing titer result, the titer will be good for the life of the dog as long as the rabies vaccination coverage does not lapse. During the temporary suspension, titers were only valid for 1 year. If the vaccination coverage does lapse, a new titer will have to be collected 30 days after the rabies booster vaccination. Next slide. Importers of foreign vaccinated dogs that have been in high-risk countries must have a reservation for examination at an ACF or CDC-approved animal care facility immediately upon arrival in the United States. Here, the dog will be examined by the ACF veterinarian and revaccinated with the USDA-approved rabies vaccine. Dogs that do not have a valid rabies titer must also have a reservation for a 28-day quarantine. Dogs will be quarantined at the facility after they've been revaccinated by the facility's USDA-accredited veterinarian. Under the new rule, there is an option to shorten the quarantine period for pet dogs with proof of at least 2 previous rabies vaccines. And if you go to our website, cdc.gov/dog travel, you can see the details for that. If an importer arrives without a reservation, the dog will be denied entry and returned to the country of departure. Next slide. For these dogs coming from high-risk countries that have been vaccinated outside the US, these dogs must arrive at the airport where the ACF, where they have the reservation is located. And these dogs won't be allowed on domestic flights or other forms of travel to locations in the US until after the dog receives required follow-up services at the ACF and is cleared for entry. Next slide. What about foreign vaccinated dogs that have not been in the high-risk country for dog rabies in the past 6 months? Next slide. These dogs will also have to meet the requirements highlighted in the all dog section. And then the importer must also have one of the following. They can have certification of foreign rabies vaccination or microchip form and a rabies titer or veterinary records documenting veterinary care was received in the country of departure for at least 6 months before traveling to the US. Or they can have a completed certification of dog arriving from DMRVV-free or low-risk country into the United States form and veterinary records for at least the 6 months before travel. Or they can have a foreign export certificate, documents the dog is at least 6 months old, lists the dog's ISO compatible microchip number, and has been endorsed by an official veterinarian of the exporting country, in addition to having veterinary record for the 6 months before travel to the US. The importer must be able to show the dog was only in countries that are dog rabies free or low risk during the 6 months before entry. Next slide. Next slide. I mentioned that the service dog requirements are the same as for all other dogs. Just a few additional points. CDC uses the Department of Transportation definition for a service dog. Under this definition, emotional support animals are not considered service dogs. Next slide. US vaccinated service dogs and service dogs that have not been in a high-risk country in the 6 months prior to entering the US may enter the US through any port. Foreign vaccinated service dogs that have been in a high-risk country in the 6 months prior to entering the US must arrive at an airport with a CDC registered ACF and have a reservation at that ACF. There is an exception for service dogs arriving by sea, for example, on a cruise ship. If they meet all the requirements in the all dog section, have a complete certification of foreign rabies vaccination and microchip form, and a valid rabies serologic titer, and are traveling with their handler, they can enter through a seaport. There are no approved land border crossings. Next slide. Next slide. CDC will continue to issue dog import permits under the temporary suspension until July 31st, 2024. Permits issued may be valid for entry through August 31st, 2024, but after August 31st, 2024, all permits are void. Next slide. Next slide. I know that there's a lot of information that I just threw at you, and so I thought it would be helpful to walk through the dog bot, which will help importers walk through the requirements for bringing their dogs into the US. People traveling with their dogs can use this tool to determine what rules apply to their dog, and these will be based on their travel dates, where the dog is traveling from, and where their dog was vaccinated. And then once the information is provided by the dog bot, that can be printed so the importer can have a record. Next slide. This quick example shows the requirements for a dog traveling before August 1st of this year. Next slide. That is US vaccinated. Next slide. And has been to a high-risk country. Next slide. Next slide. The dog bot, prints out that the dog must appear healthy and have a valid US issued rabies vaccination certificate to enter the United States. I highly encourage you to go to our website, cdc.gov/dogtravel, and play around with the dog bot. You can put in all different scenarios to see exactly what requirements need to be met for the dog to enter. Next slide. These are some resources that will be helpful to understand the new rule and get access to all the forms that I've covered. Next slide. Thank you very much for your attention.
Thanks so much, Dr. Friedman. Next slide, please. Our next presentation, Petting Zoo Perils, Findings from 2 Outbreaks of Shigatoxin-Producing Escherichia coli related to animal contact in 2023, will be shared by Dr. Christine Thomas and Dr. Angie Barrow. Please begin when you're ready.
Thank you. Next slide. So we'll start with a high-level overview of shigatoxin-producing Escherichia coli, or STEC, as it'll be referred to. Next slide. When ingested, STEC, such as the E. coli 0157H7 bacterium shown here, can cause a diarrheal illness. The infectious dose is quite low, with ingestion of only 10 to 100 organisms needed to cause illness. The shigatoxin produced by the bacteria can cause substantial morbidity and mortality by inducing hemolytic uremic syndrome, or HUS. Next slide, please. HUS is classically characterized by a triad of hemolytic anemia, which is a low red blood cell count. Next. thrombocytopenia, which is a low platelet count, next, and kidney injury that can require dialysis. HUS is usually noted 5 to 13 days after onset of diarrhea. Next slide. Nearly 1 in 5 children younger than 10 years with culture-proven STEC 017H7 infection develop HUS. Next slide. STEC is naturally found in the intestinal tracts of many farm animals, including healthy cattle, sheep, goats, and deer. And most people become infected with STEC from consuming contaminated food, such as undercooked ground beef or raw milk. However, STEC can also be passed directly to people from contact with surfaces contaminated by stool from ruminant animals that are colonized with STEC. Next slide. Let's now discuss an STEC outbreak in Tennessee. Next slide. In early October 2023, 2 cases of STEC were reported by a clinician in Northeast Tennessee. The ill children were aged 6 and 7, and both had been hospitalized. Each had visited a farm-themed event with their school class in the week preceding their symptoms. Because of the common exposure, local health departments immediately began an outbreak investigation. Next slide. Over the following weeks in Northeast Tennessee, a total of 9 people with ages ranging from 1 to 34 would be diagnosed with STEC infections linked to field trips at the farm-themed event. Next slide. 7 children would be hospitalized, and 4 children between the ages of 1 and 6 would develop HUS. None died. Next slide. To assess the impact of the STEC outbreak and identify how transmission occurred, we conducted an outbreak investigation that included epidemiologic, environmental, and laboratory. Next slide. We'll begin with the epidemiology component. Next slide. We used an online survey for case finding and exposure assessment. Schools sent the survey to parents, children, and classes that participated in the animal exhibit. We asked parents if their child attended the field trip and whether they became ill afterward. Next slide. If their child, we then asked about symptoms. Next. Illness onset. Next. Whether they saw a health provider or were tested for STEC. Next slide. We asked about children's behaviors at the event, such as animal contact. Next. Hand washing. Next. And about illnesses among household contacts. Next slide. From reports to the health department and survey responses, we identified over 80 persons with gastrointestinal illnesses after the event. Next slide. As mentioned earlier, 9 persons total had laboratory confirmed STEC infections. 4 cases occurred in children who attended the farm-themed field trips. These were classified as primary confirmed cases. 5 cases occurred in household contacts of children who had developed diarrheal illnesses after attending the event, consistent with secondary transmission within households, and so these were classified as secondary confirmed cases. 55 persons who attended the field trips experienced diarrhea and or abdominal cramps, but did not have laboratory testing for STEC, and so these were counted as probable cases. Next slide, please. And one more slide, please. Finally, 23 gastrointestinal illnesses with diarrhea and or vomiting in household members of an event attendee were counted as suspect cases. Next slide. Illness onset dates were during September 26th through October 12th. Here you see a traditional epi curve with number of cases on the y-axis and illness onset date on the x-axis. Confirmed primary cases are in red with confirmed secondary cases in orange. Probable cases are in yellow and suspect cases in blue striped boxes. Next slide. Comparing case information to control responses, we found an odds ratio of 2.4 for touching animals, but this was not statistically significant. Washing had an odds ratio of 0.6, also not statistically significant. Next slide. And one more slide, thank you. Keeping the epidemiology and survey comments in mind, we'll now transition to the environmental component of the investigation. Next slide. The event took place at a local fairgrounds and was held on September 26th and 27th for local school districts. Kindergarten and second grade classes attended the field trip with their teachers and chaperones. We estimated that about 2,300 students attended with their school classes. Volunteers included adult and high school groups, and local farms provided the exhibited animals. Next slide. As school classes arrived at the fairgrounds, they were assigned a guide and directed to a station. There are about 20 stations split between 2 areas with animal exhibits in one and exhibits without live animals in another. And where the class started, they would then move to the other exhibit area. After finishing all exhibits, the class would go to a separate building to eat before returning to their school. Right, next slide, please. We're going to focus further on the area with live animal exhibits. Here you see a picture of the building where animals were held. The exhibits included sheep, goats, cattle, a calf, pigs, rabbits, and poultry. There was also a pony that was held behind the building. Next slide. As students exited the animal exhibit area, they stopped at an artificial cow milking station. After having the opportunity to milk the cow, they were given an individual, unopened carton of pasteurized milk, which they could drink on bleachers overlooking the animal exhibits they had just visited. This is a picture of where the cartons of milk were distributed to the students. During the event, animals would have been where the boats are in this picture. As they re-entered the building with their milk cartons, they passed this calf on their left. And then next slide. They then sat on the bleachers to the wall, on the wall to the right. At this point, they were no longer in direct contact with the animals, but would be overlooking the exhibits. Next slide, please. There were stations at the event, including a portable station behind the animal exhibit. There was also a station inside the non-animal exhibit where students learned about hand washing. However, hand washing was not mandated, rather performed at the discretion of teachers and students. Next slide, please. Here you'll see a picture from the main restroom facilities. Next slide. And signage for the hand sanitizer station. Next slide. During the site visit, health department staff also collected environmental samples where the animals shown here are staff collecting called baby goats. Next, the cow area, and next is the sheep area. Next slide, please. During the week after the site visit, health department staff collected manure, rectal, and environmental swabs from 5 farms that had brought animals to the event. Next slide, please. In total, 31 were collected, using 14 manure samples and 15 from the animal environment, directly and or indirectly from cows, baby calf, rabbit, sheep, and a pig. We obtained an additional 2 shoe samples from a child who attended the event. Next slide, please. We'll now discuss the third component of the investigation, laboratory testing. We'll talk first about the human stool specimen sent to the State Public Health Laboratory. Slide. The State Public Health Lab had received a total of 10 specimens from the 9 patients with laboratory-confirmed STEC infections. There were 2 specimens for 1 patient. All specimens had the STX2 gene for Shiga toxin production detected by polymerase chain reaction. 9 specimens from 8 persons had E. coli 0157H7 isolated by culture, and for the 9 E. coli 0157 isolates, whole genome sequencing was nearly identical, with all isolates within 0 to 1 alleles in the same code. Next slide, please. Here you'll see a view of the dendrogram for STEC isolates near our outbreak strain from the National Center for Biotechnology Information. Our outbreak isolates are in red. You don't need to follow the numbering and isolate references given. Just appreciate how the outbreak isolates onto a branch of the tree in a pattern consistent with a single source of transmission. Next slide, please. Environmental testing was conducted by the state lab and a U.S. Department of Agriculture lab of 31 total samples from the fairground and local farms. The samples were for manure and swabs of the environment. Next slide. Testing found evidence of STEC, but did not isolate the outbreak strain. E. coli 0157H7 was isolated in 3 samples from sheep or sheep areas that did not have a gene to encode Shiga toxin production and did not match clinical E. coli isolates by whole genome sequencing. We also detected the gene to encode Shiga toxin 2 in 3 samples from the goat area and adjacent chicken cage at the event site. No E. coli was isolated from these specimens. Next slide, please. Using tools of epidemiology, environmental assessment, and laboratory testing, we determined illnesses in this outbreak were likely from transmission of STEC at the farm animal exhibit. Whole genome sequencing of clinical isolates identified that illnesses were from a common source and all ill persons were epidemiologically linked to the event. The site assessment identified a particularly high-risk moment when the students exited the animal exhibits and were given unopened cartons of milk to open without mandatory hand washing in between. Next slide, please. And here I will pause and pass it over to Angie. Thank you.
Thanks, Christine. I now want to briefly discuss the burden of illness associated with animal contact. So Hale and colleagues estimated that about 16,000 STEC, and that's both 0157 and non-0157 illnesses, are attributable to contact with animals and their environments each year in the US. Next slide. Most cases of STEC are considered sporadic, or in other words, they don't have discernible temporal or spatial patterns. But when illnesses have a link in terms of time, location, or exposure to an event, these cases could be investigated as an outbreak. Nationally, there were 82 STEC outbreaks linked to animal contact in the National Outbreak Reporting System between 2009 and 2022. Here you see a map of where these outbreaks occurred. States in gray had no reported outbreaks, and Minnesota had the most with 16. Among these illnesses, there were 5 deaths and 68 HUS cases. Next slide. To give a sense of the different settings potentially driving these outbreaks, I'm showing the number of STEC outbreaks attributed to each setting. If you notice that these counts don't add to 82, that's because they're not exclusive. A single outbreak might be tagged with multiple settings. For example, if the petting zoo at a local fair was linked to the outbreak, this might be attributed to a fair and a petting zoo. Next slide. Among these 82 STEC outbreaks linked to animal contact, only one in 2017 extended into multiple states. That was until 2023. Next slide. I'm now going to walk you through the most recent multi-state STEC outbreak linked to animal contact. Next slide. So compared to the Tennessee investigation that Christine just discussed, we started out to investigate our cluster of illnesses in the same month, October of last year. In fact, given the similarities between the two investigations, we wondered if they might be connected somehow. Ultimately, we concluded that they were not by comparing the whole genome sequences. They were not a match. Next slide. I want to briefly explain how CDC detects multi-state enteric illness outbreaks. When an ill person seeks medical care, a sample could be taken at that time. That sample will be sent to a local lab where the pathogen is isolated, and that isolate is sent to the state public health lab. The isolate is sequenced into using whole genome sequencing, and that sequence is added to the PulseNet database. PulseNet scientists at CDC perform regular checks to detect illnesses that occurred around the same time with matching sequences, suggesting that there might be a link between the cases. These clusters are passed along to CDC epidemiologists, who then begin further investigation of the illnesses, along with colleagues at the state and local level. Next slide. With that in mind, our case definition looks a little different than the one used by Tennessee. Since cases in our investigation are identified by the PulseNet database, they have been culture confirmed and sequenced already. So our definition is more specific to genetic relatedness and timing of the illness. We ended up with an E. coli 0157 infection yielding an isolate within 0 to 6 alleles of the outbreak strain, with an isolation date between July 3rd and September 11th. Next slide. We'll begin with the epidemiology component. Our investigations work a little differently than the single state investigation that Christine just discussed. We receive a line list from PulseNet and then reach out to the states involved and ask that they share any preliminary epidemiologic information that they have for their patients so far. This commonly includes onset date, food exposures, and animal exposures. Next slide. We initially noticed a demographic trend. All of the cases were children and the majority were males. Further, illness onset was ranging over the summer months. With STEC investigations, there's always a concern about more severe outcomes and clinical complications, like HUS, that children are vulnerable to developing. In the end, only one child was hospitalized for their illness. Next slide. The patient with earliest onset reported traveling from Colorado to Georgia for a rodeo competition in the week prior to their illness. The patient reported coming into contact with horses and steers while they were there. Next slide. Jumping forward about a week and a half, another patient became ill with the same strain of STEC. We were not able to obtain detailed information from this patient, but they did not report any animal contact prior to illness. Next slide. A month later, a child became ill after a visit to a water park in Indiana. The parent of this case reported to Indiana investigators that the water park was a part of a lake, and there was a petting zoo less than 30 feet and uphill from that lake, but the patient reported not having interacted with the animals while at the water park. Next slide. A month later, another illness was reported in a child from New York. This patient had traveled to Pennsylvania in the days prior to illness onset and visited a county fair and an educational dairy farm. The patient's parents reported that the patient had come into contact with a goat, a dog, and a cat prior to illness. Next slide. Just 2 days later, another child residing in Pennsylvania became ill and also reported visiting a fair with a friend and being around livestock there. We found this second mention of a Pennsylvania fair very interesting, and we later learned that they were in fact the same county fair. Next slide. And finally, just a couple days later, the last case of this outbreak fell ill. This was the sibling of the first New York patient and had visited the same county fair in Pennsylvania and educational dairy farm. Next slide. So to summarize, we had 5 patients reporting animal contact and 4 discrete settings of interest where animal contact was likely to have taken place. Of note, no other common exposures were observed among patients, including food exposures. Next slide. We found out that the rodeo venue our patient had visited was a large fairgrounds that hosted events consistently throughout the year. At the time of our investigation, there had been many animals and humans in and out of these facilities since the rodeo event attended by the patient. Therefore, the investigation team determined that environmental sampling would not yield results that would inform this investigation, and so it was not pursued. Investigators in Georgia did, however, contact venue staff to learn about pathogen control practices. Next slide. The dairy farm and county fair were both located in Pennsylvania. As a reminder, the 2 siblings from New York visited both venues prior to the illnesses, but the additional Pennsylvania patient reported only the same county fair. Therefore, environmental assessment efforts were prioritized for the fair venue since it was the common location between the 3 children. Next slide. So let's get into some of the environmental findings at these 2 venues. Next slide. Colleagues at the Pennsylvania Department of Agriculture let us know that this county fair had both a petting zoo and animal exhibits that were about a football field's distance from each other. So the animals in each location were likely kept separate. The animal exhibits included dairy barns, a poultry barn, a livestock barn, rabbit barn, and horse arena. Next slide. We learned that the petting zoo vendor was based in another East Coast state and traveled to different venues with their animals. At the Pennsylvania County Fair, they had a tortoise, goats, cows, sheep, camels, miniature ponies, and a llama. There was a hand washing station present with signage instructing those that had come in contact with the animals to wash their hands after exposure. Next slide. Switching gears to the Indiana Water Park. On the premise of the water park, the owners had their own personal farm with sheep and goats. Next slide. There was also a petting zoo or animal exhibit area that is connected to the water park. This included goats, alpacas, sheep, mini donkeys, a pony, and often chickens and other birds. Canadian geese are often seen on the lake. Our colleagues in Indiana let us know that the petting zoo is quite popular with water park guests, and visitors would often hold baby animals as seen in photos that had been posted online. Next. A concession stand was seen near the goat and alpaca barn. There was a hand washing station near the concession stand with signs posted and a bathroom facility near the entrance. Next. There were signs on the fencing near the animals explaining some of the risks of animal contact and promoting hand washing, but guests could move freely between the water, the concession area, and the petting zoo areas. Next slide. So we became interested in whether animals at the water park had been sold or otherwise moved around that summer. As a reminder, the illnesses associated with the county fair occurred about a month after the illness of the patient that visited the water park. Indiana investigators learned that external animals are occasionally brought on site to the water park for breeding purposes, but they were reported to be local animals. And on the flip side, the water park owners do sell animals from their personal flock, but these sales were mostly local as well. Therefore, it did not seem likely that the animals in the petting zoo from the county fair in Pennsylvania would have been at the water park later that summer. Next slide. The county fair, about 30 soil samples and a few dry swabs of the petting zoo were collected. At the water park, the Board of Animal Health collected animal and environmental samples from the petting zoo area. Next slide. And now for the results of all that hard work by our state colleagues. Next slide. STEC was not isolated. Although we could not confirm the vehicle through environmental testing, given the subcluster of patients who visited the county fair and the strong signal for animal contact, we considered this an outbreak with a suspected vehicle of animal contact. Next slide. But I do want to take a moment here to comment on the challenges of isolating STEC, as multiple factors can influence the success of environmental testing. Next. The type and quantity of specimen can influence the results. Our state partners, such as those in Tennessee, have had greater success with taking bedding and manure samples rather than swabs. Next. The time since exposure can influence results, as cleaning could have occurred in the interim and because animals can intermittently intermittently shed STEC. Next. The size and complexity of the environment being sampled can also have an impact on whether the sample catches STEC present. Next. And laboratory methods matter as well. Again, some state partners see more success with selective enrichment and use of immunomagnetic beads for 0157 for isolating STEC. Although neither the Tennessee investigation nor the multi-state investigation confirmed the outbreak strain of STEC in the environment, public health action was taken as a result of these outbreaks. So before we wrap up the conclusion of our outbreak investigations, I want to briefly introduce the updated compendium of measures to prevent disease associated with animals in public health settings. Next slide. The compendium has been published by the National Association of State Public Health Vets and the CDC since 2005. It provides standardized recommendations for anyone with responsibility or concern for control of disease and minimizing health risks associated with contact with animals in public settings. If you haven't seen it already, I believe it was included as one of the resources for this presentation, and I encourage you all to take a look. There's a lot of really great information that we don't have time to cover here, so we'll just highlight a few of the best practices that were relevant to our investigations. Next slide. Starting with recommended facilities design and use, which can include factors such as adequate hand washing facilities, appropriate flow of visitors, and complete separation between animal exhibits and food preparation and consumption areas. If some of these factors are starting to sound familiar to you, that's great. Both Christine and I have mentioned these concepts in the context of our respective outbreak investigations. Next. Specifically, the compendium recommends that animal exhibit organizers design exhibits to minimize opportunity for disease transmission. Notice how signs are present at both entry and exit from the animal area. Hand washing is built into the flow of activities, and there's a storage area for personal items such as strollers to avoid contaminating these objects. Next. We wanted to highlight how the compendium can be used in the context of outbreak investigations. So next slide. The Indiana investigation team shared the compendium with the owners of the water park and emphasized the need for improved facility design to better divide and separate animal areas. Transition areas where guests enter and exit the animal areas, and non-animal areas like the concession area and water park, as well as encouraging hand washing. During the Tennessee outbreak response, the compendium was used to develop guidance for school events in Tennessee. And we'd be happy to talk about anything related to our outbreaks and the next steps in questions, or if anyone wants to reach out afterwards. Next slide. And then next slide. Okay, and then we're just gonna wrap up with conclusion and thanks. Next slide. We do have a few lessons learned from these investigations. One, animal exposure in public settings, including school events, poses health risks to both students and their households. Two, greater awareness and implementation of practices as outlined in the compendium to reduce risk was needed at this event. And three, that One Health professionals can partner with schools, venues, and organizers to prevent illnesses at future events. All right, and then I hand it over to Christine for thanks. Next slide.
Sure, we just wanted to send out a thank you to all of our regional and metro and lab partners in this effort. I'll pass it back to Angie.
Yeah, next slide. Yeah, and I similarly just wanted to give a huge thanks to all of our state and local partners. Really, without your initiative and hard work, and frankly, just caring about this topic, this investigation would not have gotten very far. And so I wouldn't have much to talk about here. So thank you so much. All right, I think that wraps it up for us.
Thanks so much for this presentation, Dr. Thomas and Dr. Barrow. Next, oh, you're on the right slide. Thank you. So we have a little bit of time for some questions. As a reminder, if you have questions, please use the Q&A feature in Zoom to send your questions and include the presenter's name or topic. And apologies in advance, we will not get through all your questions today. So specifically for Dr. Friedman's presentation on updates to CDC dog regulation, please email CDC animal imports at cdc.gov. And I encourage you also to use the dog bot that he mentioned, cdc.gov/dog travel to access the dog bot. Okay, so let's begin with some questions for Dr. Friedman. We had quite a few questions about travel between Canada, Mexico, and the United States. And I would like to ask if we can maybe give a general answer to some of those repetitive questions that we're seeing in the Q&A.
Sure, and this is something that we've been getting a lot of questions about already in our at CDC animal imports at cdc.gov. So for frequent travelers, they can travel back and forth multiple times across, between Canada and the US, or between Mexico and the US, or for folks that are traveling from Alaska down to the lower 48, but are traveling through Canada. If you have the certification of US issued rabies vaccine form, that form will be valid for multiple entries as long as the rabies vaccine that's listed on there stays valid. So, if you have a 3-year rabies vaccine, that form can be valid for up to 3 years. Each time you cross into the United States, so you will need to go online and submit the CDC dog import form and have that receipt available for US Customs when you cross the border. That form will be available, as I mentioned, starting July 15th. It is free of charge. We recommend that you fill that form out 2 to 10 days before you travel. And make sure you enter your email address accurately when you submit that form. And those forms should be returned once you submit your application within, right now on the test form, it's within minutes. I realize as the volume increases, it may make it a little bit longer, but it shouldn't be more than a few days. But again, we recommend you submit that form 2 to 10 days before travel. In addition, if there are any Canadian citizens or veterinarians or other public health officials, for folks that are Canadian and traveling to the US frequently back and forth, those people can get their dogs vaccinated in the US when they're here, and then have the vet that they saw in the US fill out the certification of US issued rabies vaccination form, and then they will be considered US vaccinated. They'll only have to submit a new dog import form for each crossing. Hopefully that answers most of those questions. Thanks.
Great, thanks. Thank you so much, Mark. Okay, and we'll move on to the second presentation. Some questions for you guys. So when setting up the Farm Days event, can you describe what biosecurity resources did organizers use?
Yeah, thanks for this question. In talking with the organizers after the events, we didn't really identify any specific resources that had been used. And so part of our response and ongoing work in this area is to provide the compendium resources more directly to event organizers. And then we are also actually putting together a toolkit for schools to be able to use if they're thinking about going on a field trip that involves animal contact as well. Thanks.
Thank you. Okay, and then another question for you. In both the Tennessee case and the interstate case, what was the time frame between illness and environmental sampling?
Yeah, I can go for Tennessee. It was about 1 to 2 weeks between the event and when we did the environmental sampling.
Yeah, and for the multi-state, it would have been much longer than that. I'd have to look at the dates, but it would be something more like 2 to 3 months. Typically, because of the way that we identify multi-state outbreaks of enteric illness, it takes us about 3 weeks to identify a cluster of illnesses, because it has to go through sequencing and that process that I kind of went through. But then because in this specific cluster, there were cases that were much older earlier in the summer. It was even more delayed. So I think that speaks a bit to the challenges of trying to isolate these kind of outbreak strains from environments. Just timing can be a challenge, especially for multi-state.
Thanks so much. And we are out of time, so we're going to wrap up. Next slide, please. Please join us for the next ZOHU call on August 7th, 2024. Thank you so much for your participation, and thanks to the presenters. And this will end today's webinar. Bye.